Hello everybody! I would like to make a quick tutorial on how to place the implants for custom-made expander. So, we are here in the Blue Sky Plan software, which is amazing because it's for free and it allows you to precisely plan the implants and also achieve more predictability with your expansion cases. So this is actually a pretty tricky case because it's an adult male patient above the age of 35 and it's also quite high arched, so meaning we have a lot of gum tissue here, which does not make it easier. So I adjust the CBCT to the area where I want to place the tats. Here you have the rulers for this position. Here I'm going, okay. So if you look at the yellow line here, we are right in the middle between incisors. Here is the foramen, and I want to go slightly lateral to the foramen between the roots of the central and the lateral. Okay, I'm going to make that big here. This is actually a great position. Here the bumps are the rugae, so I'll try to place it behind that rugae. Here I'm selecting the implant. So I want to show it to you without the guide. So I'm just going to select the implant here. I'll go for the 13mm TAD. So let's place it here. Okay, now with the yellow circle I can adjust the angulation. I make sure that the TAD sits right at the soft tissue and I don't have any soft tissue impingement. So the yellow line is the superimposition of the intraoral scan showing us the soft tissue. Okay, so I think this is really cool because it tells us how much of the screw is actually in the bone. Here, it's pretty good. Now I'm going to place a screw right at the other side. Here's the foramen, and here it's looking good. So I'm going to select a 13mm. I want to have as much anchorage as possible. Here I'm looking at the soft tissue, choosing a space where an area where the soft tissue is not as big. Okay. Yeah. In the mouth, I probably use even a 15mm screw because I want to maximize the anchorage of the screw. Great. Okay. So now I will go to the back and place two more, at least two more. Depending on how good of an anchorage I get, I would place either two more or four more, because if I can place two TADs which have excellent anchorage, probably this is enough. If the anchorage is so-so, I would place two additional on top of the two that we're going to place now. So here we have different options. Either we place it paramedian here into the nasal cavity, or slightly oblique into the sinus, pointing towards the sinus. So when I'm going here, the problem is that the soft tissue is really thick, so a lot of the screw will just be in a soft tissue. If I'm going slightly further back, it's improving. So if we're between the roots of the 5 and the 6, so let's try to place a TAD here, 13mm, and now we're placing it oblique, pointing towards the sinus. Okay, I think this is really crucial to see, because you can see that actually not even half of the screw is in the bone. Most of the screw is just in a soft tissue. The more high arch palate the palate is, the more extreme this will be. So here I would for sure use a 15mm TAD. Let's also try to place a paramedian and see what that TAD would look like. Here I'll go for a slightly smaller one, maybe 11mm. and I would place it here. Okay, this is actually a little bit too much into the nasal cavity for my taste, so I'm going to replace it with a shorter one, 9mm. Got it. Okay. So those two options we have. Let's go for the oblique one. So I'm going to remove that. Now, what I did not tell you yet is this case is not just challenging because it's a male above the age of 30, but also the patient flies in for treatment. So I would like to use a one-phase approach where I place the TADS and the expander in one appointment. This is possible when I place the screws with insertion guides and the expander is produced based on the screw position that was planned in the lab. With the insertion guides, I need to calculate the angulation because the insertion guides cannot collide with the teeth. So I'm going to simulate the insertion guide. Here I'm going to go to replace, and here I go to Stützzahn, that's in English that would be supporting tooth, and here I make a custom made. So this must be 35mm in length and 7mm diameter. Those are that guides that come with ordinary with Tadman or with ODL, and the information is courtesy to the Tadman lab, so I'm really thankful. Okay, so this is kind of close. It would work, but let's create a little bit of a leeway space. So I can angulate it a little bit more like this. The screw position is just as fine, but I don't have a collision with the tooth. So this is great. Now you can imagine we would place a few more TADs. I would, here in that case, I would go for 6 TADs probably. And now you want to communicate this to the lab, so you're going to export it. I recommend to export it once with the supporting teeth and one export just with the screws. So you go to File, Export Data, and here if this row is checked, it will export with the supporting teeth with the guides, or if you unclick that, it will export it without the supporting teeth. So that means without the guides, just the screws. So far so good. Here then you click on export and it's done. You can send the scan to the lab and they will be able to work with that. So one more thing is pretty useful. If you check that there is no soft tissue impingement, so here it looks good. There can be a collision of the supporting tooth, the guide here, because the lab can remove that. Here maybe the TAD is a little bit impinging, so I can move it. Okay, whenever the TAD is red, this is the one selected. Let's make the window big, and here I can move it with the arrows. All right, I hope this was useful, and I will make another tutorial showing you how to import the scans and the CBCT. Thank you for watching.